Hi again. It's Topher with Community Outreach here at Riverside, and we're here with Christine Fleming today, and Marie as well, always joining me here, which is nice.
I'm the Patient Engagement Coordinator here at Riverside.
Good to have you, Marie. And again, we're here, kind of introducing the providers through video a little bit so that folks can get to see them a little bit, but also kind of hearing what they're working on and what they're seeing in their office chairs, and kind of what's a little bit about their background too, kind of what brought them here, so that people can understand who they're talking to a little bit before they start. And so without further ado, Christine, hi.
Hi.
So practically speaking, I am on Pacific time right now. Marie is on Eastern time right now. And tell us about your time zone and where you're located.
Yeah, so I am in Northern Ireland. So I'm 5 hours ahead of you, Marie. Yep, so we're on Greenwich Mean Time.
Cool. Yeah. So for our ravenous audience out there, you are now spanning several time zones, with us. But Christine, you've been working at Riverside for how? I guess let's back up a little bit. How did you get into the mental health space? What was school like for you? What was your kind of trajectory?
Yeah, so I have an undergraduate degree in psychology, and so I've always kind of been interested in that, in understanding people and behavior and those patterns as well. After my undergrad, I took a break from school. I did some outdoor ministry with my husband, and then decided to pursue a master's in counseling. So I started that while I was pregnant with my first son in 2017. Finished up in 2020 through a program at Dallas Theological Seminary at the Washington, D.C. campus there when we were living in Northern Virginia. I did some clinical practicum work at some psychiatric residential facilities, and then moved into a position there at Riverside, starting at the end of 2020 to begin working with clients there in private practice.
Sorry, I'm muted there. 2020, that's an interesting time to start, I would assume.
Yeah.
And that was the time you were in office too?
Mm-hmm. Yes.
Can you talk about how that was for you?
Yeah, it was really, I think for everybody, such an interesting, difficult time navigating the pandemic. I think we're still seeing the effects, and probably is something that will be studied for years and years to come, the effects of the pandemic on mental health. For us as a collective, as a society, and then also developmentally at different stages. At that time, I was working with a lot of young people, and kind of through that time, I really started to see a lot of how grief and kind of people process that grief, not just the grief of the deaths that we were seeing around us, but the grief of just losing the normal things in life, the grief and the loss of what we don't cut this out. I don't know what I'm talking about.
Oh, you're all good. I understand what you meant.
Okay.
Yeah.
I don't know.
Like the loss, like someone like dear to people. It's like just like the loss of like how their lives typically are,
Yeah.
like going into
It
like
was
loss.
crazy. Yeah. there were so many people who, it was just, they didn't, we didn't have or realize or understand how to cope with that level of stress and fear, and anxiety. People were so isolated. And I think that there still is, effects from that where, we see people isolating more and more, right? And so, yeah, it was interesting. It was interesting that that's kind of the start of my counseling career was there at the beginning of the pandemic. Yeah, it was an interesting time. Yeah.
Yeah, I mean, I would assume so, and for all the reasons you said, yeah. But it's not like it was a one and done thing, like you said. It became kind of this new normal that we're all dealing with, and so it's very, I'm sure, informative for a lot of your work ongoing as we're all living in that post-pandemic new reality. Which it sounds like I would agree. Has been more isolating and more people in their corners. Less. The community. Yeah. Anyway, that's an interesting way to start your in-office time when everyone else is going out of office and remote. Since then, as you've seen patients and kind of gotten been working over the years, what kind of demographic or cohort or whatever you want to call it, what kind of people are you seeing in these in your rooms, and what are you dealing with most often with them?
Mm-hmm. Yeah. So right now, because I'm an exclusively virtual provider, I do find it that adults and maybe older adolescents, that space, it's easier for them to work with. It's harder, I think, for young people, for children, to be as engaged virtually, just because of, where they are developmentally. So at the moment, I'm working with mostly adults. I have a few adolescents, on my caseload, but I think it's probably most appropriate that I work with adults just because of the virtual space, that I'm in. A lot of people that I'm working with are dealing with issues related to anxiety. Sometimes it's general anxiety, social anxiety, and then also different forms of OCD. So I think a lot of times people think about OCD in terms of the compulsive type behavior, but actually the obsessive piece and the patterns of obsessive thinking is actually quite a common thing, having those intrusive thoughts and not knowing how to manage a lot of that thinking as well. And then depression, and people that are also recovering from traumatic events and PTSD. So issues related to sexual violence, domestic violence, as well as other traumatic events. I have clients that I'm working with. And so that's kind of the general population of people that I see on a day-to-day basis, both men and women.
If we could hone in on that OCD for a minute, I think I'm a layman, so to paint myself and who I am here, I'm a layman. I don't know much about the practice itself of therapy, and different modalities and things like that, but and even different diagnoses. But with OCD, I hear a lot about ADHD recently, and I think like the awareness around that has swelled, and that people understand it a little better, maybe, and a little less stigma. OCD is an interesting one, and you're the first one that's really brought that up in that way that I've spoken to recently, and I'm interested in that obsessive part. The compulsive is what they show on TV, I feel like, is like the tics or things like that. what do you mean? What might that? What are people dealing with that might be dealing with maybe more of the obsessive side of that spectrum?
Mhm. Yeah, so like you said before, OCD, there's multiple parts to it, or it can present in different ways. A lot of times what we see maybe on television is that compulsive behavior, right? The door checking, the ritualistic behavior. But a lot of times obsessive thinking, right, is another piece of that, and it's not as seen, and so it looks different for different people. Essentially what's happening in the brain, right, is that our amygdala, the fear response center, that is a wonderful tool that God has given us, right? There's a little bit of a glitch where you interpret something in the environment, or you interpret a bit of information as something that's dangerous when it's actually not dangerous at all. And so so somebody who struggles with obsessive thinking, maybe with relationships. So relationship OCD or ROCD is a type of OCD where someone would be obsessing over their relationship. Is this the right relationship? Am I in the right relationship? And constantly checking and mental checking whether or not. And no matter how much they think about that question or try and ease that, it actually makes the thought stickier, and it makes the distress even more intense. There's another type of OCD called scrupulosity. So I'm working with a client right now who struggles very much with scrupulosity, and it's that concern of, am I doing the right thing, right? Is this right? Is this wrong? And to not get it right feels like a life or death situation. It's very, very distressing, and it's very debilitating for people when they're just trying to live their lives, to be thinking, if I choose, if I make the right decision, is this the right peanut butter? Is this the right peanut butter? And to be thinking about that being a life or death scenario is what their body is telling them. Even though we can see, from the outside, well, that's not a dangerous situation at all. It's just peanut butter. But because the thought is obsessive and it feels like a dangerous thing, right? That's where those kind of obsessive thoughts are coming from and coming in. So the way that it's treated, exposure response prevention, is a treatment with ERP and CBT, learning how to retrain the brain to realize that actually that's not a dangerous situation, right? And learning to make or help the amygdala be less sensitive to that type of thought or pattern of thought. So there can be obsessions about a lot of things, any things, right? We're talking about scrupulosity or ROCD in particular. But there's, there can be obsessive thoughts. You see something on the news, right? And it's just that rumination, thinking over and over, and more. The more you think about it, the more distressing it becomes.
Yeah. I mean, just being real, I feel like I might be bordering on that sometimes. That's interesting.
Well, sure. Everybody does have intrusive thoughts, right? Like we have intrusive thoughts every day. The thing is that most people, when they have an intrusive thought, it doesn't get stuck, right? It's like, oh, that was intrusive. Okay, I'm just going to let that go. The problem with someone who has maybe obsessive thinking patterns is they're not able to let that thought go, right? They hold on to it. Keeps renumerating over and over again. So it's learning how to train your brain to realize, thoughts are just thoughts. I don't need to do anything with that thought. Which is, it's difficult. It's hard work. Clients work really, really hard. It's they're working really hard.
Yeah. Well, it's good. I mean, it sounds like the benefit there is a freer resistance, and that's worth the work. It sounds like. Marie, anything from your side? I'm like all deep in this
Oh,
OCD thing
okay.
now. Like,
I really appreciate you talking about like these like honestly lesser known aspects of OCD because like as you said like a lot of people just think it's like flicking the lights on and off or always cleaning your hands and like those are parts of it but it's just such there's so many things as you said like so many things that can be rituals or obsessive and some people are like oh I guess I'm just an overthinker I guess I'll just live with the stress of this because I'm just an overthinker and that's just who I am not knowing that there's like actually tools out there that can help them and I love that that's something that you've helped people with that you have like modalities in place to help people cope with this thing and like it doesn't have to be just like a life sentence of always having to struggle with anxiety and like the constant fear and like danger of things like this like there's actually like things that they can do to help them and I really do appreciate you like shining like the light on like these truly like lesser known things and I think just having the awareness of people knowing that this is a form of OCD and that they can have help is like so important and it will help so many people.
Yeah, absolutely. Yeah.
And I think too, like, about OCD as well, like what when you do you have like a new client with OCD, what are like some myths that you like completely like dispel the first time you get there? Like what are some things that people you have to like let people know like, oh, like this is OCD, like it's common for people to say this, but in reality, like what are some like misconceptions that people tend to have about OCD?
Yeah. I find that a lot of people, when we start talking about OCD, there's a lot of shame that's connected to it. That they're very ashamed that it's something that they struggle with, right? Because they know it's not logical, right? A lot of people who have OCD, they're highly intelligent actually, and they're somebody who values thoughts and they value thoughts from different perspectives, and that's actually part of the problem is that they value thinking so highly and they consider things from a lot of different perspectives and angles, right? And so because they place thoughts at such a high importance, right? They recognize that this pattern isn't logical and that there's something a bit off, right? And they're ashamed that they can't figure it out, or they're ashamed that they feel like something's really wrong with me because I know logically this isn't right. And at the same time, I'm still stuck in this pattern of behavior or this pattern of thinking, right? And so, like you said, you know, being able to say, no, this is what this is. And there's nothing wrong with you. You're not doing something wrong. This is OCD, and OCD is treatable. A lot of people, when it comes to mental health, especially with OCD, but with a lot of other things, there's so much shame attached to it. Because they're thinking, well, I shouldn't be dealing with this. Or if I just thought differently, or if I just felt differently, then I wouldn't be having, these problems, or I wouldn't need help. And the reality is that, well, I mean, we all struggle, and we can't expect ourselves to be perfect, right? Our brains all work in different ways, and different people need help with different things, and sometimes we do need help, and there's no shame, when we need help and we need extra support. It's important that we ask for help. We ask for help. Someone who has diabetes asks for help, every day with their insulin and measuring things. They don't have any problems with going to a doctor. Someone who struggles with any kind of, other medical issue, or health related issue, or biological issue. And the same is true for mental health, for things like this, for OCD, right? You struggle with this, you have OCD, that's nothing to be ashamed of. There's nothing that's wrong with you, right? It's something you struggle with. And it's something that you can manage, and you can get the tools to help.
That's well said. So that's awesome. We kind of did a deep dive, I guess, on one of your, specialties here, and that was pretty enlightening, honestly. But to the breadth of stuff that people deal with out there. We mentioned grief and relationships and PTSD and and OCD. To people who are out there on the fence about getting care, you kind of said it, but what would you say to them? To people who are just kind of thinking, should I do something about this?
I think I would try and understand and meet them where they were, right? Well, what is it about therapy that feels so intimidating? What is it that you're afraid of? It sounds like you need help. It sounds like you could use some extra support. And so what is it that is stopping you, right? Like, this is definitely, has an effect on the way that you function. It has an effect on the way that you're able to engage and interact with the world. It has an effect on the way you view yourself, the way you view, other people. And so, why wouldn't you reach out to get some help and some extra support? Trying something new can feel really scary. But that doesn't mean it's not worth doing, right? When it comes to therapy, one of the biggest kind of indicators that it's going to work is the willingness of the client. And so I have a lot of clients who are very willing, and they work so hard. Like, they work so hard, and they can be so proud of themselves for how hard they work. But it's important that the client is willing and ready, to explore things. It's hard work, but just like, you go to the gym and you work hard, and you wake up and you feed your kids and it's hard, and you're doing life and it's hard. It's another thing that's hard that we're meant to be doing. Like, we're meant to be connected. We're meant to connect with another person, right? One of the things that I think we as humans just long for is this desire to be, we have a desire to be known and to be accepted. And that's one of the most healing things, that a person can experience. And the therapy room is the space for that. To be fully known and to be fully accepted, it is so restorative. It's so restorative. And so there's a lot of components, I think, to therapy. Yes, it's hard work, and yes, it's, all of these things. And at the same time, it's a place where there is relief and safety and vulnerability for you to work with whatever it is that we're working with, whether it's OCD, whether it's anxiety, whether it's depression, whether it's, traumatic events, right? Like, we need that connection. We need that acceptance and that space.